Hello all. In this video we will see about drugs used in myocardial infarction. Apart from theory part, this topic is useful to all the doctors in practical aspect also. Coronary heart disease is one of the major cause for premature death. The rupture of atheromatous plaque, which is present in artery, this atheromatous plaque is present when present in coronary arteries, and when the ruptures causes occlusive thrombus, which leads to acute myocardial infarction. In acute myocardial infarction, the progression happens over 6 to 8 hours, which results in cell death in the infarcted area. Infarcted area is the affected area marked with yellow here. When there is the thrombus here, then the whole part gets affected. The objective of treatment is to limit myocardial ischemia and therefore limit the consequent cell death. So, what are the treatment objectives? Immediate treatment starts as follows. First, you should give morphine and pethidine through IV cannula 10 mg and pethidine 50 mg. It reduces anxiety, it reduces pain, therefore reduces anxiety, and therefore it reduces sympathetic overactivity. Followed by, you should give thrombolytics. The thrombus, you have to lyse it, you have to destroy it. Streptokinase is given, the 1.5 million units infusion over 1 hour. Antiplatelets is also given. The thrombolytic should be given as soon as possible, most probably within 6 to 12 hours, because they limit the damage. The antiplatelet drugs which are given include 300 milligrams of soluble aspirin orally. It reduces mortality, and continued with 75 mg to 150 mg per day. Also, clopidogrel is also added. Followed by anticoagulants like heparin. It prevents the extension of thrombus and prevents deep vein thrombosis. Vasodilators including nitroglycerin and sodium nitroprusside are given in as IV infusion to reduce cardiac workload. Vasodilators are given, but you should also take care to avoid reflex tachycardia. Once vasodilators act, the dilated vessels in turn will cause the heart to beat faster, tachycardia. So you should take care to avoid that also. Finally, you could also give high flow oxygen, and also AC inhibitors, beta blockers and antiarrhythmics. AC inhibitors within 24 hours it is given. Beta blockers, IV atenolol, it decreases arrhythmia when administered 5 to 10 mg within for over 5 minutes. Antiarrhythmics are also given. So this is the flow chart which explains how myocardial ischemia affects your heart. That is how it causes cell death. And in the next chart we will see at what stage what drug is given. Myocardial ischemia causes cardiac pain, which causes anxiety, and sympathetic stimulation, which in turn increases cardiac work and decreases cardiac efficiency. It worsens the myocardial ischemia and causes cell death. The myocardial ischemia, which causes cardiac pain, this cardiac pain could be stopped by giving analgesics so that the patient will not feel pain. This anxiety can be lowered by administering diazepam. Therefore, you are avoiding sympathetic stimulation. In turn, sympathetic stimulation can also be blocked by beta blockers. Therefore, the cardiac work and cardiac efficiency are kept under control. Vasodilators are given to decrease cardiac work. In worsening ischemia, myocardial ischemia, fibrinolytics oxygen do their work, which reduces cell death. So, our aim using drugs is to reduce the cell death, which is a result of myocardial ischemia. So the long-term treatment aims at lower dose aspirin, beta blockers, AC inhibitors. It prevents ventricular remodeling and cardiac failure. The risk factor management includes the patient should avoid smoking and reduce cholesterol. Hyperlipidemia is one of the major risk factor. The patient should also keep body weight under control, do exercises which will help in above 2, and control diabetes and hypertension, which are also risk factors. For dentists, when you are dealing with patients with a known history of cardiac problem, when you encounter an acute episode of angina, You administer 0.5 mg of sublingual nitroglycerin when you suspect MI, when pain is not getting subsided even after giving sublingual nitroglycerin, then you can suspect MI. You administer pethidine or shift to the physician as soon as possible. The procedure should not be increasing the anxiety of the patient, as anxiety precipitates angina. Therefore, in CHT patients, morning first appointment is given, because the waiting period, when the waiting period is more, the patient may get more anxious thinking about treatment. So to decrease anxiety, we are reducing the waiting time, and avoid adrenaline in patients with history of cardiac coronary heart disease. So these are the steps taken in preventing, in treating, and in immediate and delayed treatments of myocardial infarction. Treatment of myocardial infarction is a huge topic. So this 5-minute lecture will help you in dealing with the short question and viva question when asked. Thank you.